three sons, and they are all in school, and they're very active. They play sports, and so with them being active and being out and about, that increases my chance, and like any other, many other parents who kids are in school, increases the chances of us catching COVID. So last year when COVID first broke out, you only seen where it was saying it was attacking older people, it was killing older people, and it shut schools down. But now we're back in school and we're going through the process whether you want to wear a mask or not. So my kids, they have the option to, and they were wearing masks, and I was putting peppermint oil, using Nazine to sanitize and disinfect, and keep their nasal passages clear. But my third son, that didn't help, of course. So he was at a football game, and when he got home, he felt really, really, really bad. He started having headache, and he was having fever. And so we all know that those are COVID symptoms. And so me, I kick into mommy mode, and I start to use alcohol to rub him down, try to break his fever, and to give him, I was giving him Tylenol also to kind of reduce the pain from his headache. Well, I did that, and a couple hours later, I went to check on him. The fever still hadn't broke, and he was still complaining about his head. The next morning, I did it again. Well, because his fever didn't break and that didn't happen, and that is something that old school remedy that I know to work, I called the doctor. The doctor luckily had an appointment the same day in which we went in. He confirmed that Jatiran had COVID. And so, of course, that's panic. That's a red alert for us. So we get home, and, I announced to everybody, Jatiran tested positive. We need to disinfect the house, and he will be quarantined. So I quarantined Tyron, and then I was able to take care of a few things before I started having some pain in my back. And when I started having the pain in my back, it was an excruciating pain. It was like a pain that I never experienced before. And so, of course, I'm alarmed that to me, I'm probably getting sick or something. And so I go through, I push through strong, even with my back hurting. I take care of a house, I get groceries ordered, I do all those, get things, and get everybody comfortable in place, get us a routine in place. Well, during that routine and my back hurting, I also, and this is probably maybe the second day, I started having like some real pain in my chest cavity. But this pain was like, it felt like that somebody was caving it in. Like I could feel it working really fast. I could even, Cone, why would you just come get in my video? Move, get. So anyway, with, oh, I'm so sorry. Okay, so anyway, with the pain in my back and my chest cavity caving in, I said, okay, these are COVID symptoms. It's time for me to get tested. So I called my doctor, and I did not want to go to a walk-in clinic. I was just going to wait on her because I know that at the walk-in clinic, some doctors give you stuff and they don't. Some of them don't. They just send you home with an inhaler. Well, she couldn't see me for like 2 days. And so I'm starting to trip out. I'm getting scared. I know that I have hypertension. I'm researching. I'm also worried about my son. I'm dealing with some things. And so I'm really getting weaker, and it's starting to really, really scare me. So I asked my family for prayers, of course. I let them know, I've been around Tyron, and right now my back is hurting and I'm having some excessive tiredness. But the tiredness was not like I worked hard or anything. It was like a sedative, like somebody unplugged me or something. My limbs were really, 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 really weak. Well, my cousin, she said, the doctor gave me prednisones. And so I was like, okay, I know what prednisones are. Those are steroids. They're used to reduce the inflammation in the lungs. And so gracefully, I had a whole bottle from where I had the flu. And I started taking them, and I was getting instant relief. I was able to sleep, and I was still building strength. I was able to do some things. So I get to my doctor, and she confirms that I had COVID. And she was very proud, and she agreed that the prednisones may have helped, because she really do believe in treating the symptoms of things. And so she also told me that I qualified for the monoclonal antibody treatment because I have the hypertension and just being overweight. And so I asked her what the monoclonal antibody treatment was, and she said the monoclonal antibody treatment is the Trump treatment. That's what she called it. She said that it is designed to duplicate the cells, the antibodies needed to fight the coronavirus. And what that does is like an immune boost. And so, of course, I was excited. I needed that because I had not been vaccinated, and, you know, I really don't want to. Well, I go through, we complete the referral process, and I go have the treatment. And what they do is, it's like through an IV, they give you these antibiotics and these different things. You have to read and look up on it, but it's called the monoclonal antibody treatment. And it worked. It really did help me. It saved my life. But with that monoclonal, Colin, can you please do something? The monoclonal antibody treatment had you would have like flu-like symptoms the first day, and I did, and they was very, very, very bad. I think that was the most suffering that I actually had, was the flu-like symptoms from the monoclonal antibody treatment. But the day after, I was okay. I was this dog, come, you should have just went somewhere. But anyway, afterwards, I could feel myself getting stronger, but my chest, from where it was, feel like it was repairing, it was kind of weak, it was tender. And I'm a person that when I'm asleep, I love to yawn. I love the way it feels, like I'm like a baby lion, but I could not do that. And so that was discomfort for me. And so I started doing the breathing exercises, and doing the breathing exercises, they were painful for like the first day. And I started having some blood in my chest, and I knew to go to the hospital because that sounds like pneumonia. But gracefully, my oxygen levels were okay. I didn't have pneumonia, so I went home and I just began to increase the breathing exercises 3 times. You breathe in 3 times, and then you cough out. And so each time that I did that, I could feel myself getting stronger, and that is with the inhaler. I'm using the inhaler, of course, too, with that. But after about day 10, I was okay. But what I was starting to experience was some brain fog. My memory was fading. I was stuttering. I was tripping in my speech. I could not focus. Nothing was clear. And I was still just kind of tired. Not like the sedated tired, like how it was when COVID first attacked me, but I was really tired. And so I started researching. I learned where COVID had lingering side effects such as tiredness and brain fog and stuff. And it really set me back because I had just started my counseling certificate, my Christian counseling certificate with Grand Canyon University, and I could not do anything. But in that, I also learned that with COVID, you have to keep your emotions under control, keep everything intact, because each time that I got upset about something, it set me back. Like, I would be strong, I'll be okay, I'll be on the up and up. But as soon as I got upset, I think the Haitian refugees things that was going on, I was upset about that. Then Tyron's brothers, they wasn't showing any compassion. His father hadn't called, and all those different things that, you know, I was processing as a mama, just very, very upset. But they were really setting me back. So I really encourage those who are suffering to please guard your heart and to make sure that you protect yourself. You want to disengage anything that's going to impede your healing process. But with that being said, I can encourage you all to look into the monoclonal antibody treatment and to do whatever it is you need to do to take care of your family and to while we get through these tough times. But thank you all for this opportunity. God bless you. May the Lord keep you.